The purpose of this video is to help you understand and identify instruments for this course that are also used for the majority of general cases. Names, categories, and instrument functions will be discussed. Remember to pass each instrument in the manner it will be used. Special care with blades and sharps. Remember, all instruments come in pediatric size, smaller for our smaller patients, and bariatric or longer instruments for our deeper surgical cavity needs. This is the Balfour retractor with depth blades and a bladder blade. This is a self-retaining retractor. Don't forget this has a screw to tighten the blade down. This instrument is used for gynecological or bowel surgeries. All retractors are used to establish exposure for the surgeon in the body cavity or area of surgical exploration. The Richardson retractor. Some have double-ended depths like these. Some are single-ended. This is a right-angled retractor to hold back layers of deep tissue. This is a handheld retractor. The C.W. Mayo retractor or body wall retractor. This retractor is used in abdominal surgery. Body wall refers to its curves and it can hug the abdominal wall very well. This is a handheld retractor. The Deaver retractor. This comes in varied widths. This is a handheld retractor. It is curved to retract around organs. Always remember to pad around retractors with wet lap sponges below the retractor to protect against organ or tissue injury. The malleable or ribbon retractor. This is similar to the Deaver retractor, but it can bend to fit the area to be exposed. Vaginal retractors. One is a self-retaining vaginal retractor that allows for placement into the vagina for biopsies or viewing for pap smears within the cervical os. The weighted Heaney retractor is a single-ended vaginal retractor that is weighted to stay in the vagina for procedures such as dilatation and curettage that allow for drainage that can flow down the retractor or to get tissue samples that can be obtained from the openings. The Army-Navy retractor. It's a double-ended handheld retractor. They have differing depth ends. They're not for use in deeper cavities. The Sen retractor is a double-ended retractor that is L-shaped with a right-angled end and a rake end on the alternate end. It's also called a three-bent prong end. So there is a sharp and a dull side. This is a handheld retractor that is used in superficial surgeries such as on hands and feet or plastic surgery. The sharp rake retractor. This is a handheld retractor that is used in small bone or joint surgeries or superficial depth surgeries that grab the skin edges for allowing the retractor to be pulled up, like in a grasping manner for exposure. The Parker retractor. This is a handheld retractor that allows for holding back tissue. It is double-ended, however, each end is equal depth on both sides. Harrington retractor. This is also called the Sweetheart retractor. This handheld retractor has a heart-shaped end that is designed to reduce retraction trauma to organs such as the liver, intestine, and it allows for deep retraction. Wheatlander retractor. This is a self-retaining retractor that has a finger ring and ratchet to self-hold. The Love Vein retractor. This is a handheld retractor that is used to retract around blood vessels and nerves. The retractor's curve encompasses the vessel. The Fish abdominal wall retractor. This flat disposable retractor allows for compression during abdominal closure. It retains the omentum and visceral layers of the peritoneal or abdominal cavity during closure. There's an attached string and ring to decrease the chance of retained surgical objects. The Pool suction tip. This suction tip allows for abdominal cavity suctioning. This can be used in two ways: pinpoint opening, suctioning for smaller areas of suctioning, or multiple openings to remove large quantities of fluid or irrigation from surgical sites. It's used in many abdominal surgeries. Our sample is disposable, however, there are metal ones which are reusable. The mixture or right angle clamps. These come in multiple lengths and they're used for clamping, dissecting, grasping tissue, or passing a suture. Clamps, such as this instrument, means that they have ratchets or can clamp down. The bulldog clamp. This is used for cardiovascular surgeries. It's used to clamp blood vessels in like a spring-like action. It stops the blood flow without damaging the blood vessels while controlling or suturing is performed. This is the Alice clamp or the Alice forceps. It has a row of teeth that can cause damage to tissue, so usually this is used in tissue or organs that are about to be removed. The Babcock clamp. This is non-perforating, so it's an open basket type of clamp. The Peon clamp. Similar to a Kelly or a hemostat, but this is thicker, heavier. It allows for grooved jaws to clamp and create hemostasis to control bleeding. The Coker clamp. Notice the two teeth at the top of this instrument. This will cause tissue or organ damage and is usually used when the organ or tissue will be removed. The curved and straight hemostat or Kelly clamp and the curved and straight mosquito clamps. These are used to clamp blood vessels to establish hemostasis or to tag, which means to place at the end of suture when suturing or closing. Jaws can be straight or curved. Mosquitoes are smaller than the Kelly hemostat. Adson tissue forceps with and without teeth. The tissue forceps are used to hold tissue when suturing skin closed or packing or dressing of wounds. There are thumb grasps for controlling this hold. Tissue forceps with teeth are used for suturing. The smooth or without teeth tissue forceps are used for dressings and packings, etc. DeBakey tissue forceps. These are used in most vascular procedures or in any procedures to grasp when you wish to avoid tissue damage. These tissue forceps have a ribbed grip panel along the forceps ends. Cardiovascular or CV clamps, designed to control blood flow like the bulldog clamp, allows to establish a repair of a blood vessel without damaging the vessel. Sponge forceps. This can be curved or straight. It does have an opening. It can be used alone as an instrument to evacuate clots without injury, or you can use it with Ratex sponges. You fold and clamp as shown in these slides to mop up blood or drainage from the site. A curved sponge forceps is used with tonsil sponges or tonsil balls in tonsil and adenoid surgery to mop up blood and drainage from a surgical site. The Adson tonsil forceps or clamp. It's used for small blood vessel clamping or to pass a suture tie. It has horizontal serrations in half of the jaw and has a longer shank than a Kelly or a hemostat. It's used in many procedures, not just in tonsil and adenoid procedures. Towel clamps, piercing or non-piercing. For clamping towels around sterile surgical sites. Care must be taken not to pierce the skin below or to move pierced towel clips on drapes, as this exposes the field to a contamination. Use non-perforating if planning on moving the towel clamp. Some trays only have piercing. You might not have both in your trays. Mayo-Hagar needle holder. This needle holder comes in all sizes and lengths. It has stubby serrated jaws to hold suture needles for tissue repair. Remember, we load the needle a third back from where the suture thread is swedged on. Julian needle holder. Used for delicate closure of light tissue and to hold more delicate surgical needles. It can be straight or curved jaws. Ours are straight and the ends are tapered. The curved Heaney needle holder. This has thicker curved jaws. It allows for a better view when suturing with curved shanks. It's used often in gynecological or cardiovascular surgery. The heavy jaws are meant to hold the suture. Load suture opposite of the curve of the needle holder. We will practice this in lab. The Castro Viejo needle holder. This is a micro needle holder that can be straight or curved. Ours is straight. that has a locking control in the middle of the needle holder. It must be passed to rest in the surgeon's thumb and index finger in a horizontal, not a vertical manner. Knife handles. These are for holding surgical knife blades. Remember to pass and receive back with care. Keep your fingers out of the way. The number 3 knife handle holds the number 10, 11, 12, and 15 blades. The number 4 knife handle holds the 20, 22, and 24 blade. And the number 7 usually holds the 11 and 15 blade. Pots, scissors. Usually used for trimming and opening of vessels in cardiovascular and thoracic procedures. Various sizes are shown in our instrument sampling. They're used based on the surgery and tissue or vessel size. Many times you make an arteriotomy in a vessel with a sharp knife, and then you use pot scissors to further open the vessel. Their angled shape facilitates this. Iris scissors. These have short blades that are mainly used in eye or plastic surgery. They can have a straight or curved blade. The Heaney gynecological scissors, used to cut or dissect dense tissue such as fascia or uterus tissue. They have short, wide, or thick blades. Bandage scissors. These are used for cutting bandages or plastic casting material, padding, or umbilical cords at delivery. They're angled with a lower blade that's slightly longer to eliminate injury of tissue on the bottom blade. It's self-protecting. Manual loading Liga clip applier and automatic clip applier. These are used for ligation or occlusion of blood vessels or to allow for hemostasis to clip and cut vessels or stop bleeding of a vessel. Titanium clips are used. Gynecological blunt and sharp curettes. These are used for scraping or debriding tissue, as in a biopsy, excision, or cleansing, and procedures such as a dilatation and curettage for missed abortion, which is a miscarriage, or abnormal uterine bleeding samples of cervical and endometrial tissue. Tenotomy scissors. These can be curved or straight. Ours are curved. They have tapered ends for delicate cutting needs. Straight Mayo scissors. These are also called suture scissors. They're used for cutting denser fascia tissue or thick tissue, or to cut heavy suture. Wire cutters, used to cut monofilament wire, sternal wires, or surgical pins in orthopedic surgery. The type depends on the size of the wires. Short or long Metz and Baum scissors. These are curved scissors that come in varying lengths, used to cut more delicate tissue. These scissors have a longer handle to blade ratio, and they taper towards the tips. Sometimes used to cut finer sutures also in surgeries such as cardiovascular surgeries. They are usually called Metz. Short or long curved Mayo scissors, usually used to cut deeper or thick tissue, such as uterus, muscles, breast tissue. As with any other instrument that comes in various lengths, it depends on the depth of the cavity or the area of the surgical procedure. Give the appropriate length based on where you are. The skin stapler. This is used as an approximating skin closure device. Roughly 45 instruments were discussed here. We will again practice passing of these instruments, loading of sutures and blades on the respective instruments as well. These instruments are a great foundation for most surgical procedure openings, retracting, and closures. Welcome again to the wonderful world of surgery.